when it came down to the brass tacks, actually writing out what this policy means and whatnot, that's a hard process, isn't it? That wasn't necessarily you. That was probably the previous
Right. I wasn't in the job then.
administration.
They published the final rule before the change in administration. It's very complex. And there's certainly a lot of different sort of views and a lot of different interests that weighed in, pretty heavily, I think, in the whole process of getting the public feedback on the draft rule and then the final rule and all of that going on. So
do we anticipate this will change much? I mean, will there continue to be feedback, and will this continue to morph over time?
yeah, so a couple things. One is that we are in an ongoing process of we take questions, we interact with, and we do a ton of outreach. And for any of your listeners who want to interact with us directly and have us come and speak at events, or you want to talk to someone about it, please contact us. We are more than delighted to do that. And we do that every single week. And we've got a clinical team, we've got a policy team, and we're always doing that kind of outreach. We also take all sorts of feedback and input, and then we respond with FAQs and like information sheets and all of that. So if you go to our website, you'll see that we keep adding FAQs. And we also add information sheets when we get a whole bunch of questions in a particular area. It's like, we thought we clearly communicated, but communication is only in the eye of the receiver, right? So if they're not hearing it, we clearly have not said it right. So we're going to create an information sheet that that tries to do that. So there's a lot of, I don't know if it's really morphing so much as it is to say sometimes no rule is going to cover, especially in healthcare where it's so fragmented and so local, it's never going to cover every particular circumstance. And so that's where we can, help to provide some clarification to say, here's what the rule says, and hopefully that helps people. And that's an ongoing thing. And I always consider that that's not a bug of our system. I think that's a feature of our system. You define the big policy, but everyone keeps adjusting. We all need to keep adjusting to make it work.